dignitaries on the dais, my senior colleagues and colleagues. Nice to come to Agra after so many years for the purpose of talking on the equity or high-tech ophthalmology. Now, what does equity connote in eye care? It means that availability of eye care services to each citizen of the country, regardless of caste, creed, educational level, financial status, gender, age, place of stay, and cost of treatment of the disease. This is what actually equity connotes. Now, when I spoke in Hyderabad on the levels of eye care, now you can see very clearly that there are 8 levels of eye care, and we have to provide eye care at all these levels, and each level is a massive level. Let us take a look at what is our requirement vis-a-vis our availability of the services. The population of India 122 crore, 1220 million. Annual child birth rate 26 million. Number of operating surgeons 10,000. I think I am maximizing it, maybe even less. Number of optometrists 44,000. And now you see this table showing you what is the rate of the annual new cases, incidence, then backlog of past years, and total current disease burden. Cornea, both eyes, cornea is diabetic retinopathy cases 1,04,000. This is calculated at the rate of diabetes being 2.5%, and every 6 patient of diabetes new cases every year, and already we have about 48 lakh cases of diabetic retinopathy existing in this country. Similarly, glaucoma is 7.8 lakh new cases every year, and 369 lakh, 3 crore 60. Now this is presuming that glaucoma is 6% in all the population in this country, and annual for some diseases I am calculating taking the birth rate 26 million. These figures may be changed if someone has got more authentic figures, and wherever it is lacking I need to fill up. Now coming to the fact that is equity in eye care possible in this nation? Yes, equity is already happening. You know how it is happening? Through our primary health center. These I call as the partners of NPCB. The primary health center, the community health center, district hospital, NGOs like the one we have Dr. Deshpande's NGO and many other NGOs in this country. Medical colleges, regional institute of ophthalmology, and countless number of private practitioners in this country. They are all providing services to the poor as well as the rich people of this country. Why equity is essential in eye care? Because it will ensure that nobody goes or remains blind in India for the want of eye care. And let me tell you that National Program for Control of Blindness is a highly successful program, or most successful program of the Ministry of Health and Family Welfare. It is running in all the 642 districts of the country, including the difficult terrains, including the 7 sisters of the Northeast. We have gone down right up to the level of Tripura and all other places. Why it is essential? Let us take the example of food availability and eye care availability. Now equity will ensure that nobody sleeps hungry in India, and eye care availability will increase. Nobody suffers from any eye disease for the want of the eye care. But still we have 5-star hotels. Why have high-tech? We have 5-star hotels. The one in which we are holding this convention is the example, and it depicts the development of level in the society. For many other purposes, of course, you need the 5 stars. But it also depicts the developmental level in your country, and high-tech ophthalmology similarly depicts the advancement level in the subject. Why both equity and high-tech ophthalmology are required? You have different income group people and different people, work-wise also. So a person who is having quite good income may not like to go for the same treatment as the low income group. But that does not mean the low income group person will have a low quality service. NPCB and our partner NGOs, they all ensure that high quality services are delivered to each and every person all across the country. At least that is our motto. And persons belonging to high strata of the society, they want recuperation, they want recovery very early. A person, at the ministerial level or at a, Supreme Court judge level, he may want the recovery after cataract surgery within 2 hours. Because he cannot wait, and nor the nation can wait for him to recover and join the service after 15 days. He needs to join after 2 hours. So that is why we need to have high-tech ophthalmology. Is high-tech ophthalmology available side by side with equity? Yes, very much available in the country with the presence of Regional Institute of Ophthalmology, big NGO hospitals. We have the Shankar Netralaya, we have the L.V. Prasad Eye Institute, we have the countless number of Lions Eye Hospital in this country, we have the Chitrakoot, I was just talking to Dr. Jain, done more than 1 lakh surgeries in a year. We have Dr. Deshpande here. These are the exemplary people, in the field of NGOs. Then we have big private hospitals, and I was just talking to my wife, Vasan. Vasan has come all across the country, in a big way, and it says that it is the biggest network in the whole world. So we need people like that also. Whatever is their way of working, I am not going to delve into the details. And some private eye clinics. So, because of the following, we need the both, as I just mentioned, income level, comfort desired, working status, urgency to get back to the work, awareness about latest advanced technology, and on-site availability. Somebody is, aware of FACO, he is aware of rollable IOL, he is aware of, laser technique of removing cataract. So he wants to go for that, and he has got the means. Why not? Let him have that. So what are the factors determining equity or high-tech ophthalmology? Workload at hand. As I said, this country has 61 new cataracts every year, and countless number of refractive error patients who need spectacles. Then ensuring quality service, resource availability. Resource availability may be poor in hilly terrains and far-flung areas of the nation, but in metros, resource availability is excellent. Workforce availability. In some states, even for the extracapsular cataract extraction surgery, surgeon is not available, particularly in Bihar, Odisha, some part of the northeast. So, what is the learning curve of the techniques to be used? Sometimes the learning curve may be very difficult and hazardous. So that also has to be kept in mind while introducing high-tech ophthalmology. So this here there is one-to-one teaching to take care of the fallacies of the training. Mass applicability of the technique. Some techniques are to be used on mass level, like small incision cataract surgery for cataract and prescription of glasses for the refractive error. 2 main causes of avoidable blindness in this country. Then subject development in the nation is required. Now subject development, I mean high-tech ophthalmology. When I say subject development, it should be of the ultimate level, so that other nations look towards India when they want eye care services. Like, we have the people coming to New Delhi and other parts of the country for getting their eye diseases treated. So, subject development also has to be taken care of. Thank you very much, ladies and gentlemen.